Yep, it will come up. Yep. All right, we are live. Good afternoon. This is American Surgery Center Bariatric Program. We are here with Dr. George Ibrahim. This is our volume 13. Today is November 25th, the day before Thanksgiving. So we are going to discuss navigating holidays as a bariatric patient for today's session. Dr. Ibrahim is going to help us to better prep for tomorrow and the day after, I guess. Dr. Ibrahim, if you can please introduce yourself, and then I'll start the PowerPoint from the other side.
Thanks, Mr. Erkan, for introducing me. I'm George Ibrahim. I'm one of the bariatric surgeons with CHRIAS Group. Our group located here locally in Delaware. I'm general surgeon, certified in that practice. And I did 1 year of fellowship in bariatric and minimally invasive surgery. And I've been with the CHRIAS Group now for over 3 years. Our group has been standing in Delaware since 2001, so almost 20 years. As you see, we are a large group of surgeons, very versatile experiences. We perform so many different procedures of bariatric surgery and revisions. And we are the most experienced in the state of Delaware. As you see from the left side of the screen, Dr. Erkan, Dr. Wen, Dr. Peters, Dr. Singh, Dr. Veda, myself, and the last and the best part of the group, Sidney Mambek, our physician assistant. Today, we're going to talk about the holidays. And
so, Dr. Ibrahim, right before we start, so I just want to make sure we introduce our dietitians and nutritionists, Fran, Amy, and Beth, so they are part of our program as patients start with the with our programs, or as they may stay even after the surgery, so they are still having appointments as part of the wellness program. Now, for the topic that we are going to discuss, one thing that I wanted to tell you earlier was from the United Medical ACO Wellness Program, Amy, our dietitian who's leading the program, she actually did a session just last week. So we were talking about patients with diabetes mainly. So that video is available if anyone who wants to actually check that out. So that also helps because some of our patients, obviously, they do have diabetes as well as the other underlying disease. So now, if we can kind of like maybe just set this up from the right side. So what I mean by that, this year is going to be different for bariatric patients, not just for the Thanksgiving coming, but it's also this almost 8 months. We have a lot of restrictions in terms of what we can do physically, who we can be with, how many people can be in one room, one home in a way. So psychologically, it's going to have a lot of impact on many people. So but the reason we thought this would be a really good topic for today, right before the day before Thanksgiving, is what's going to happen tomorrow. So, and then I do want to ask you this in a couple different ways. So patients who are getting ready to have a surgery like a couple months from now, what it means for today, like tomorrow, and for patients who may have a surgery in 2 weeks from now, or the patients who just had surgery. So if they had surgery 3 weeks ago, what would happen tomorrow, and how we can help them so then we can better prep them. So now we are all yours.
It's in fact very, very good question. And it's not just bariatric patients, it's in fact the entire population. And you'll be fascinated to know that there's studies about weight gain during the holiday seasons. In average, every person gains weight in the holiday season across the boards, not just bariatric patients. And when you look to that, why it happens, it's the culture around holidays. When you think about it, the day or 2 days before, people on the run between shopping, preparing, if they are being invited to other people's house or they are having the party at their own place. So what happens typically is you are busy daytime preparing, so you skip your meals. By the end of the day, you are ravished, you are famine. Then you end up overeating. And of course, the available foods are all sweets and dessert and goodies, a lot of sugar, a lot of fat in it. And day or two later, you jump on the scale and I gained 5 pounds in 2 days. So that's exactly what happens. And when you think about how to prevent this from happening, you have to break the cycle itself. So the first advice is, in your preparation for holiday, whether you're shopping or cooking or preparing food, don't skip your meals. Don't forget to eat. So it's not by the end of the day you didn't get any calories in, and now your body and your brain is like sounding the red alarm. We are starved. So you end up overeating. So through the day, make sure you get your meals, have snacks. So by the time you are going to that party or you're eating your Thanksgiving dinner with your family or friends, you don't overeat. That's one thing. Another side of this too also is the available food. It tends to have so much sugar, so much butter, and so many dessert and goodies around, which very hard to resist. So it doesn't harm to have a mindfulness about this, meaning don't make all the options available from that category of food. Have alternatives available. Like let us say, I'm going to have some veggies, I'm going to have some fruits, I'm going to have some nuts, seeds. All these things tend to have less sugar in them, much more proteins, which tend to make us feel fuller, and also high fiber content, which serve the same purpose. So don't make just the only available sources are pure sugar in front of you or pure carbs. Have alternatives too available for you. In fact, when you think about holidays, I think in my own opinion, they go in 2 phases, the preparation phase, then the aftermath. You think about it. Preparation phase is when I'm running, preparing, shopping, cooking, I'm skipping my meals, I'm hungry and overeating by the end of the day. That's what we just spoke about. The second phase of this is the party is over. Now I'm having time to relax, 3 or 4 days, or Christmas break from schools, for example. And because I'm super tired from all the work I did before, shopping and preparing, now I'm relaxing. I'm sitting on my couch watching TV and I'm bored. I'm not doing anything. So I end up eating. And that's in fact a double whammy when you think about it. So I'm bored, I'm overeating, but I'm watching TV, so I'm distracted. I'm not mindful of my portions. So I'm eating more than I really need to eat. I'm eating unnecessary snack. I'm not hungry, but I'm eating. I don't know why. Mm-hmm. So, and of course it's the leftover. So it's still, again, the dessert, the cookies, the goodies that we have at home in tons and abundance. So try in these days after the holiday when you are relaxed, don't be totally sedentary. Try to do some activities with your family or friends, like going out for a walk in a mall or something like that. Or if the weather is nice, walk around the neighborhood. And again, we'll go back to the starting point. Try not to be distracted while you're eating, meaning if I'm having my meal, I'm going to go to my dining room or my kitchen, have my meal without being distracted with watching TV, for example. So I can measure my portions. I can eat and feel my full without being distracted by watching the TV show I'm watching. Again, back to the choices. And in fact, the thing about the holidays, we intentionally tend to have good tasting food. So that entails so much carbs, so much sweets, so much butter. So also if you're doing your own cooking, there's a lot of online recipes with low calorie intake foods. Like for example, if you're trying to flavor your food, rather than putting too much salt and butter on it, try herbs, for example. If you're cooking some cookies, rather than putting sugar, try to use artificial sweeteners like stevia or something like that. Another thing also is we tend to overestimate how much food we need. So we have these large dishes, large plates, and we're loading them with food. What about having a smaller size plate? And when you eat and you feel you're full, you're done. If you need more, you can go get more. Rather than having that big plate, then you feel I need to finish now all that food because I picked it up. I don't want to waste it. In fact, that's another thing about when you go in for an open buffet. Let's say you're invited to a friend's house or family, and it's an open buffet style dinner. Then again, you get these large size plates and you start putting food on them. And before you realize it, you put too much food that you can eat. So maybe choosing a smaller size plate will help you control the portions. If you think about
Dr. Ibrahim, I think maybe so just play the devil's advocate a little bit. So like you guys are already going through these with the patients, right? So our patients, especially on the bariatric side, they already know many of these, but the difficulty is, so everyone around you is trying to focus on this one big meal. And like, you know, we went through this in our lives as well. So you don't have to be patient, you don't have to be a bariatric patient to deal with the difficulty. So like the best prep for them, for us, for all of us, like even for me, like for this year, because of the COVID, I did gain close to 15 pounds. So on top of what I already had, and now like I'm trying to figure out how actually I can avoid certain things, and it's tough. I think it's difficult, especially for when we take this to a different level of the BMI. It's even tougher. So now, if I'm hearing you correctly, and I'm going to maybe repeat some of what you already said, but I think this, like not making a big deal out of the meal itself on the Thanksgiving day, so then you're not skipping your breakfast and you're not skipping your lunch just because you're going to have one big meal. That's kind of the key. Is that, do I understand that correctly?
Absolutely, Kemal, you're right there, because here's what happened. I mean, if
We lost the voice a little bit, the sound.
okay. Can you hear me now?
Yeah, no.
Okay. I was just saying, you're absolutely right. You nailed it in very simple terms. Yes. I mean, this is the problem. You skip your meals. Then, end of the day, when you're done with your works or tasks, you are more hungrier than usual because you starve yourself. So without feeling or thinking about it, you end up overeating.
Absolutely.
So to break this cycle, from the root cause itself, don't skip your meals. Make sure you have snacks. In fact, even if you had your meals through the day and you're not that super hungry, even before you go for that dinner an hour or two before, have a little snack, if you're not feeling that hungry, because that will make you feel fuller. So when you sit for your dinner, you don't overdo things.
Sure. So now you were going through it, and I did interrupt you a little bit. So what else would you like to tell us for the patients? Now, is there, this would be also a little bit challenging for those who may have just the surgery. So how they can avoid overeating? If I had the surgery a month ago, what would be the best course of action for me?
Well, number one, being mindful of the portions. I mean, we always tell our patients and one of the things that our dietitians educate them about is choosing the right portion for yourself. Now, if you're using a large plate, it's going to be very hard for you to judge that. But if you're using a size plate that you know that's normally what you should be eating, that will help you to control that issue. Because one thing is, the way you feel satiety and fullness is different after the surgery from before. And if you just had your surgery done, it takes your time to develop that new feeling, or you learn about your body now, how it's changed and how you respond to that feeling. And that sometimes happens regardless of holidays after surgery, that you don't know yet your new limits and you overdo it. And you start feeling sick in your stomach or something like that. So the number one rule is use a measuring unit that you know that's my enough, that's my limits, that's my new stomach. It could be 3 or 4 ounces, a small plate or a small cup, something you know I can eat this and I'm satisfied and I'm not overdoing things. That's one way of doing things, besides not skipping meals. Also is the choices of the foods. I mean, again, you should have alternatives. Try to avoid high calorie, high sugar, high fat. So if you're cooking and using heavy cream, you can substitute that for skim milk, for example. If rather than putting sugar in something you bake, use artificial sweeteners. And the list on stuff that are less calories. Also try to budget your calories among your foods and snacks, but more importantly, avoid empty calories. What do I mean by empty calories? Stuff that are not truly food, but they have calories, like liquids, for example. One thing about holidays, it's a time that all of us indulge in having maybe alcoholic beverage, okay? So I'm not saying totally no. I mean, if you had your surgery a few months ago and you recovered and healed and things are going the right direction, so having a sip of something like, let's say, a small glass of wine, maybe half a glass, taking a couple of sips, is not totally wrong. But it's easy to slip and you finish an entire bottle because liquids don't stay well in the stomach. It's the design of the GI tract to process liquids much faster than solid food. Then liquids could easily have tons of calories in them and you don't realize that. So rather than drinking soda, maybe try sparkling water or club soda or something that doesn't have calories in it. That's another thing also people after bariatric surgery struggle with is liquid calories. So besides avoiding certain foods, having healthy alternatives or snacks, sizing your meals, having smaller plates, also be mindful of liquids.
So can I just share this with you? So this is my daily drink. So I do have cucumber in it and ginger and mint. Like I do have the water like the night before, so it stays there overnight in the fridge. And the next day I kind of like just put more water during the day. So then it kind of actually makes it easier for me to drink more water. So like again, like I have mint, cucumber, and ginger. So it actually makes the water a little bit tastier, and there's no calories.
That's in fact very nice trick, and you can add any kind of flavor you like lemons, strawberries, bananas, any kind of fruit or vegetable you like. And you're right, just sit in water and let it sit in your fridge for overnight. It will give it nice flavor and almost no calories.
Yep.
So it's a very good trick, in fact.
Now I have one. Then we have what you actually provided us with the replacement of when they are baking something with the like the egg with the egg whites and replacing some of the butter with yogurt. Now, one other thing I was going to say, which I do, and I did mention this in the wellness webinar as well. So when I know that I'm going to be in a setting where I may have to eat, like if there is a great access of food, the only way that I can kind of control myself if I have 2 or 3 egg whites before I go to those events. Is that something that would be right for the bariatric patients?
Absolutely. I mean, having a snack that's made of high protein food or high fiber food, it's very highly advised because when you think about it, the metabolism of proteins tend to last longer in the human body. So let us say I'm invited for dinner and I had my sleeve surgery, let us say a few weeks ago. I'm now allowed to eat normal diet and I'm worried. I don't want to be sitting on the table and overeat and do something I'm not supposed to do. So yes, having some egg whites, for example, before I go for my dinner, a handful of nuts, maybe a serving of carrots or celery, something that's high in fiber, is in fact a very nice trick. It makes you feel full. So you still can sit down on the table, have your normal meal, your size portion that you're comfortable with. And at the end of it, you're satisfied, you're full, and you didn't overdo things.
Sure. And the one other thing that I see as a problem, sometimes when you are with the wrong mix of people, and this is also an issue with patients with diabetes, I think, as well as patients who are going through any type of diet. If the household is not aware of what you are going through, and if they're not part of what you are doing, it becomes so difficult. So now, in fact, this session, I think my sisters are watching. So my older sister's home, there's always some food somewhere. So there's baklava and there's chocolate and there's this and that. So it's almost impossible to do any type of diet in her house. So in my house, I have no excess food. So I don't have any ice cream in the freezer. I don't have any chocolate. So like none. If I have to get some, I have to leave the house, which kind of stops me. So sticking with the people who will keep you on track. Can you kind of elaborate that?
Okay. In fact, you brought up 2 good points in the same time. Number one is out of sight, out of mind. So I do practice the same behavior like you. When I go do my shopping, I avoid buying that kind of food. So I don't have it at home and I don't overeat it because it doesn't exist. But comes the problem when I'm invited to somewhere and they don't have the same mind or the same behavior. So what should I do? Well, most of times, it's we all require support to a certain degree. Like it's very good to have someone in your circle of friends or family who understand what you're going through or your needs or your way of life and sharing the same values and practicing them with you. But let us say I'm invited to a place, and most of times when we go for dinner with other friends or family, we bring a dish with us. Like, let us say everyone will bring something they like or something they like to drink or eat. Then bring with you a food that you know it's better for you to eat. Like let us say, like my family too, my father's family side are all diabetics, for example. So when there's a gathering, they are mindful of that fact. So there is always some sort of a snack or a food that should be adequate for diabetes. And the same thing, let's say I'm invited to some friends and I have diabetes. Maybe then I'll bring a snack or a dish that's healthy for a diabetic person. Mm-hmm. So at least when I sit to eat and mix and socialize, I don't feel left out. Okay, I have something I can eat without compromising my diabetes or blood sugar control. It's also, I think it's a good thing that you talk to your people around you. I mean, we as human beings, we need support. We need to feel not left out. We need to feel that people understand what we're going through and are on the same page with us. So talking to family and friends and having a buddy or a friend going with the same steps with us. Like let us say, if I'm dieting, if I'm having a friend or a family member dieting with me, that will encourage me to adhere to the diet or following a certain way of eating or exercising or physical activity of sorts. So having that helps. So in other terms, as sticking to people who keep you on track, like as the slide we were just showing now. Mm-hmm. Meaning it's like having your own personal trainer or coach who's like understand your goals and he's pushing you forward. So if one of you guys, like let's say I'm doing that with a friend or family, if I drop, he will pick me up and keep me going. And the same thing, if he drops or falls down, I'll pick him up and push him forward.
Absolutely. And the other thing that I was thinking, so all of these live sessions we have done, they're on our CHRIAS YouTube channel. So I think with the Black Friday, there will be 4 days we are going to have. So it will be a good time for our patients or who may be thinking for the bariatric surgery. It would be a good time to kind of go through these videos and then see what may be helpful for them. So we have, as you know, we actually put these in a really nice way so then patients actually can see exactly which topic we are discussing. And in some cases, hearing these again may be helpful just because it's a good reminder. And these are all from our surgeons, different surgeons. This is our second session with Dr. Ibrahim. So I think just making this, taking advantage of these resources is kind of the key. But we know that it's going to be difficult, and we want to make sure that our patients understand that we are there to help. Just making these lifestyle changes, right? So it's not just the change that we are making for 3 weeks, 5 weeks. It's a long-term change that we are restructuring how we eat, how we exercise, and just keeping all these together. I think that's going to maybe help just better prep for this mentally. And but again, the whole issue is this is not just for the bariatric patient, but this is true for all of us. It's a challenge, and hopefully we can go through this without gaining too many calories. At least I'll try personally. So now, Dr. Ibrahim, what are you doing? Anything special tomorrow?
Well, yeah, I mean, I have my parents at home already and my sister. So pretty much going to be a family dinner. And guess what? I'm the cook. So
All right.
I'll try to apply all that advice I just gave to
Okay.
myself. So I'm prepared.
Don't
I
burn
have
the house down, so try to be careful. But I do thank you for, especially the day right on the Thanksgiving Eve, because I know that you are still in the office, you are seeing patients, and I say this all the time because we really do need to acknowledge how much you guys are doing for us, and your availability, physicians' availability is a different kind of a deal where um, many people, when they go home, they don't have to do their job, but that's not the same for you guys, and we do appreciate that. And hopefully our patients will do well for this Thanksgiving, and we want them to know that we are here to help if there's anything they need, and we'll be back next week with our other live events. Dr. Ibrahim, thank you so much for joining us.
Thanks, Mr. Erkan. I appreciate the opportunity, and happy Thanksgiving, everyone.
All right, happy Thanksgiving. Bye-bye.
Bye-bye.